But I was just reading this study that there's a few studies actually, because I checked it, this wasn't the only one, to show that doing exercise, particularly aerobic exercise and resistance training, in these studies was proved to be just as comparatively effective as doing psychotherapy, and in a lot of cases more effective than taking antidepressants when it came to conquering depression. And that might be something where a lot of people are like, yeah, duh, but bro, there is not the same push to get people healthy and active in a lot of cases as there is to get them on antidepressants. And that is something that's so confusing for me. Like, if I knew someone who was just spending a lot of time in a dark room, sleeping in, doing whatever they were doing, like just eating shit, being unhealthy, not exercising, playing PlayStation, whatever the hell it is they're doing in their little cave, the first thing I would suggest, if they were having a hard time mentally, I'd be like, get up a bit earlier, go for a walk, get sunlight on your skin, eat a bit healthier. Just start with that. But in like the eyes of society today, the first thing they would get told to do is go see a doctor and get on antidepressants. That was the other thing too. In the long run, doing exercise was 5 times more effective in some of these studies. So continuously showing up and exercising over like a long period of time, I think it was like 8 months they tested over, was 5 times more effective than using antidepressants for 8 months. So I'm not disregarding those ways of dealing with mental health. I think therapy is a very good thing for everyone. I think it makes you emotionally intelligent. It gets you to face whatever demons like bring out the worst sides of you. 100% recommend it. And if antidepressants are a path you want to go down, you feel comfortable doing it, your doctor recommends it, I'm not disregarding that whatsoever. But there just isn't the push there should be for getting people healthy. Does that make sense? Like, there just isn't. And I'm like, you can't really change how you feel. If you're staying in the exact same environment, you're not changing the setting around you, you can't just change how you feel without taking medication. But you can change what you do. And if you change what you do, you might not need that medication. You know what I mean? Like, if you change what you're doing and you start exercising and you start eating healthy, which is proven to conquer the same things, you might get through it without needing medication. And then you don't have to wean yourself off it. I don't know, I'm not a doctor, but I just found it interesting and it's something I've picked up on, but yeah.